Welcome to the Heart of Healthcare podcast. I'm Hallie Tecco.
I'm Michael Esquivel.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all. Hello, listeners, and welcome to the very last episode of the year. I hope you're having a great holiday and gearing up for 2025. Before we dive in today, I just want to ask a quick favor. This show is very much a labor of love, and we are so grateful to have been able to nearly triple our monthly downloads since the beginning of the year. But we don't want to stop here. We want this show to reach as many healthcare innovators as possible. So if you're a loyal listener, we would so appreciate if you could take a second while I'm talking right now to open up Spotify or Apple Podcast on your phone and give us 5 stars. It means so much to us. Thank you. Okay, today I'm with my co-host, Michael Esquivel, and we're going to be talking to our friend and colleague, Megan Zweig. Megan has been at Rock Health for almost 8 years now, where she is president and CEO of Rock Health Advisory, the arm of Rock Health that publishes cutting-edge industry research on digital health. Today's episode will be a recap of the crazy year that we have had. Megan, thank you for joining us.
Thanks so much for having me. So good to see you, Michael and Hallie.
Megan, welcome. So excited to have you here today. All right. So Rock Health's about to release its annual year-end report. So Megan, I'm going to cheat here and ask for a sneak peek. What are the highlights of this year's report?
Happy to give the sneak peek. The team prepped me well for this. They are hard at work on that report. As you probably know, we do these quarterly reports. We're looking at all investment that is flowing into US-based digital health startups to get an understanding of where investors are placing their bets, what the trajectory looks like relative to what we've seen in the past years. I think we're going to land at about $10 billion in funding when everything is said and done. That's pretty consistent with what we saw in 2023. I think what's interesting, though, is we sometimes will look at 2019 as almost a benchmark year of where we were before the world really changed with the pandemic. And if you look at funding in 2019 compared to this year, it's actually about the same when you adjust for inflation. So the 2024 absolute number is bigger, but inflation adjusted, it's actually about the same. And I think some of the big changes that we've seen across the past few years, one is certainly fewer mega deals. So 2020, 2021, we saw a huge amount of capital go into the digital health space. You saw a ton of these deals over $100 million. That has certainly slowed down. So kind of seems like less capital available for those later stage companies. You have overall lower deal sizes. I think that has to do with the skewing towards investments in seed, Series A, Series B deals. And I would say, I think it's just a reflection of the kind of new ethos that we're in, right? Investors now have been saying for the past year or 2 years of, hey, we want to invest in companies that we know are going to be sustainable soon, that are going to be profitable soon rather than growth at all costs. And so I do think that kind of to some degree, lower funding levels, lower deal sizes is really a reflection of that.
Yeah, it's interesting because there's got to be less money, right? Or VCs, a lot of VCs are kind of nearing the end of their funds. And we know a lot of them, like a lot of startups, are struggling to raise or raising smaller funds than in the past. How much of that plays into this versus the number of startups available to invest in?
Yeah, I think what you're saying is really interesting because it speaks to actually like the major theme that we're going to convey in this report, which is that it was interesting more of a year of like the Goliaths rather than the Davids, meaning that there's been a lot of concentration, I would say, of capital, of power, of influence into some of these bigger players. We were looking at, I think it was a PitchBook report. If you look at General Catalyst and Andreessen Horowitz, they have raised 20% of all of the venture capital that has been raised this year. That's not in healthcare, that's across the board. And if you look at, it's something like only 9 funds raised 50% of all of the capital that were raised by venture funds. And so you kind of have this like intense concentration of capital towards these biggest funds. Of course, GC Andreessen, like they're investing heavily in the digital health space. I think they had more than 15 deals each this year. And so to your point, I think you do see just like them playing a bigger role, obviously, in where bets are being made and kind of what the innovation landscape is going to look like in the future.
That's wild. Yeah.
That is crazy. So even with that concentration of capital, it feels like, Megan, is it fair to say we've returned to historic norms here in our funding pattern? Or because I know we got to take the pandemic period out of that analysis a bit. So, you reference we're back to inflation adjusted 2019. So
yeah.
Have we reverted back to historic norms?
I think what's interesting about 2019 is what did happen after. I mean, in some ways, the pandemic was such an anomaly, but you also had like a good amount of liquidation and investors getting money back from a lot of the M&A activity and IPO activity that spiked during that period. And so it'll be interesting to see how much of that happens in this coming year, because when we look across 2024, you actually saw M&A at the lowest levels that it's been in like over a decade. Like we saw 86 deals in terms of digital health companies being acquired. And so it's interesting. I was chatting with an M&A banker a few months ago, and she was saying like, we're seeing a large volume of possible transactions, but a lot of them just aren't happening. And sometimes that just has to do with like the CEOs not necessarily agreeing on who is going to be the CEO and how their teams are going to come together. But I think a lot of it had to do with just this disagreement on prices and buyers wanting to get good deals and sellers not really ready to give up what they've built for a lower price, given the amount of venture that they may have raised. And so I think when we look to the coming year, and I was chatting with an M&A lawyer recently about this, he was like, I just expect to see what we saw more in 2020 and 2021 in terms of a really high volume of exit activity. Michael, I'm super curious to see, just given the number of boards that you sit on and your vantage point, like what you see there. But it'll be interesting to see what happens next, because I think you do have a lot of investors and entrepreneurs, admittedly, who are kind of looking for liquidity in this market that hasn't really had it for the past year or 2 years.
Yeah, it's a fascinating, conflicting comment there when you talk about liquidity and M&A. So I agree with you and the feedback you've captured. Just looking in Fenwick's client base, we certainly have seen and seeing more term sheets coming through where we're seeing a lot of what I will colloquially refer to as roll-up and bolt-on type activity, right? And I think it's a realization in our sector that point solutions in and of themselves are not viable businesses, but rather platform plays are the way to go. What's fascinating, though, is what I'm seeing a lot of in these private M&A deals is using private company stock as currency. So when you talk about getting liquidity, these transactions don't oftentimes actually generate any liquidity for the founders and the employees. And in fact, they're rolling their equity in and buyers are saying, look, I'm going to try and use that preferred stock valuation that I got in 2021 as the valuation barometer for the equity currency I'll issue as part of this roll-up or bolt-on. And so it's really is an interesting intersection where we're seeing more increased activity. Term sheets are definitely starting to come together if we can get alignment around the relative valuation, because when you're doing private M&A, that is the real crux of the issue. But assuming you can get around that, I think we'll see a lot of activity. It's just not going to result in a lot of recycling of dollars at this stage anyways.
I was going to say, I think one other thing that does feel different from 2019, even with funding levels being pretty similar, is I think there's this acknowledgement of the role that services play. And we've been having this conversation for a long time, but I think if you were back in 2019, we had a lot of entrepreneurs and investors who were still like really on the SaaS train. And the SaaS train is a good train, but it was very much like we are going to have the margins, the multiples, the valuations relative to traditional SaaS companies. And I think what I've seen a lot more of this year is just this like real acknowledgement from the builders that are like, you know what, it's going to take a lot. Like implementation is a lot in healthcare. Change management is a lot. This isn't just sticking a technology solution into place. This is like, we are putting together customer advisory boards. We are putting staff like in hospitals to help with training and implementation. Like we are going to make sure that this works. The goal is not get in and get out. It is to be like a dedicated, supported partner. I think that is smart for the long term. That's going to create stickiness. It's going to create real traction and integration and hopefully outcomes. But I think that acknowledgement is going to have an impact on, okay, what are the margins of these businesses? How should they appropriately be valued? And so I think that there's this acknowledgement from investors too, who are shaping these deals that, okay, there's a lot more tech-enabled services in this space, and there's even just a lot more SaaS, plus the kind of implementation services that are required to make these things actually stick and work and build alongside the actual end user. So I think that's a positive thing that's happened over the past 4 to 5 years for sure.
Yeah, I think the only thing I would add to this is I recently did my own little data research project on what happened to all of the unicorns that were minted in 2020 to 2022, and was shocked, just absolutely shocked that most of them are actually okay. Like they raised enough money and it happened so quickly. The shift happened so quickly in 2022 that they were able to right size and re-strategize and have enormous runways. And who knows what's going to happen to them? There are going to be a ton that don't work out. But compared to those that went public during that time, the private ones are okay. But now here's what we're starting to see is that those that are raising additional funding, which is a third of them have raised additional funding. A lot of them are raising at a down round, or in, what does Rock Health call them now? An unmarked round?
Yeah, unlabeled round, or it's like a bridge round, or going back to the existing investors. Yeah.
So there's enough of an interesting business there for investors to continue to put money at, but they're like, I'm not paying 2020 prices for this. And so I think what we're going to see, this isn't about what we're going to see. Let's talk about what we've seen this year. What we've seen this year is that this has really been the first year that 2 of them filed to go public this year, right? So that's really cool. 2 of them shut down. Forward was the big one. And then 4 of them were acquired or merged, and 2 of those were actually, I think, pretty meaningful acquisitions. So I think that they just got that cohort had actually good timing. They raised a lot of money while the money was flowing, and they might not exit at the prices that they were valued at one point, but a lot of them have the opportunity and have had the opportunity to build meaningful businesses, albeit right-sized ones.
Yeah, Hallie, you really hit on a key point that I've observed with not only clients that I have the privilege of working with daily, but just in conversations with fellow members of this terrific ecosystem, which is they had the runway and they brought the financial discipline to really lean up the organization, to streamline operations, to really give themselves a fighting chance. And because they had raised significant amounts of capital, they were able to do that. And I agree with you. I think a lot of them have right-sized their businesses. They've turned from a growth at all costs mentality to a growth with profitability overlay focus. And we've seen it. So I think those that were fortunate to raise 9 digits plus in capital had the runway to do that. I think it's going to be really, really fascinating when they do go back out to market. But one thing that founders should keep in their minds, and I say this all the time, like, raise the capital and have clean terms. Don't go and do it.
We have a whole episode on this.
Acts. And unnatural acts on this, and try to keep that top line valuation. What's better is that you bring in the capital in a thoughtful, founder centric way, so that you can not only live to fight another day, but when you get to that exit event, you're not having to pay this ever-growing liquidation stack and try to overcome it and keep things simple there. So anyway, I'm rambling on a key point. I love to focus on, Hallie, as you know, and just bits of guidance. But
and we have that episode. I'll link to it in our show notes because it's a good one. It's helpful for anyone that's fundraising right now. Okay, so I want to know from you, Megan, some of the key sectors that investors were pouring money into this year. AI is top of the list, I'm sure, but would love to hear from you kind of some of the areas that were of interest.
Yeah, I think here it wasn't too much of a surprise in terms of where funds flowed. So you're right. I think it was something like nearly 40% of dollars went to companies that use some application of AI, whether that's generative, whether it's machine learning, whether it's deep learning, et cetera. we saw a lot of money to continue to flow into the mental health space, into weight care. Again, not too surprising as you're seeing a lot of digital solutions pop up to complement the rise of GLP-1s. Lots of investments, too, in non-clinical workflow solutions. So when you think about some of the big raises around like a bridge for ambient scribes, that would fall into that bucket. And I think like mental health is one to look at. I think that has been a top-funded clinical area for us for a really long time. And I think what might surprise people is a lot of the deals that are there are companies that are brand names but known for other things. So actually, when we look at the top funded mental health deals, it's companies like Maven and K-Health and MIDI, where respectively, Maven is offering behavioral health benefits alongside its family and fertility benefits. You have MIDI, who's offering menopausal care, but also with wraparound mental health support. You have a K-Health, who's really a front door for digital access to primary care, but they're integrating mental health care into that. So I think we've known this for a while, but it's nice to see that I think one of the really positive outcomes of these very curated virtual care experiences is this integration of physical and mental health care, right? And just the importance of like when you're trying to work alongside a patient to solve a real problem, you're trying to do that not just physically, but helping them mentally too. And that's going to drive outcomes. So that was promising to see those raises. A lot of that money is still going into the tech-enabled services space, which you might expect with mental health.
What about direct-to-consumer versus B2B?
Yeah, so I think that what's interesting in terms of what happened this year, and this was a little bit surprising, is that some of the direct-to-consumer moves didn't come from the small burgeoning startups. They came from some of the biggest players in the space. And so you had Amazon, for example, rolling out Amazon Clinic to support people with low acuity needs. I think you had pharma playing in a very different space than they're used to. This was the year that Lilly Direct came out and Pfizer for All. So these pharma companies really creating direct-to-consumer experience for people to tap into telemedicine, get prescriptions if they need, tap into chronic care management programs, et cetera. And again, it's super interesting because this isn't a space that they've necessarily played in the past. And one thing that I saw over the past couple of months, which has been really interesting, is Lilly announcing its partnership with Ro. So speaking of direct-to-consumer, and Lilly has said that they're now offering their weight loss drug Zepbound through Ro, which, as you know, Ro and Hims and Hers and Weight Watchers, like they've all built these direct-to-consumer platforms around weight loss. They're prescribing GLP-1s. They're often doing so with compounded GLP-1s. And they can do that so long as those drugs are on a shortage list. And there's all sorts of kind of complex regulation and lawsuits happening around that. But I think it was really interesting for Lilly to make this move and say, hey, we're not going to kind of like wait for the courts admittedly to battle this out or for regulation to catch up to what we want, which is limiting compounded drugs. We're actually going to partner with one of the key players in the space, Ro, which has built trust with a ton of consumers to say, hey, if we can't beat them, join them. And so now we're going to kind of play in this space.
It makes so much sense.
Would not have expected that.
Yeah, but when you think about it, you're like, oh yeah, that makes sense. Because if you think about the folks that are going through a digital health option like Ro, it's those who probably aren't using it for diabetes management because then they could get it reimbursed. They're using it for weight management and it might not be covered. It's likely not covered. So they're going to be paying out of pocket anyways, which is like Ro and Him's whole thing is like, these are her things that it's probably easier to get through us. So I think that one makes a lot of sense. And it is super exciting to see these sort of partnerships. That was actually one of my predictions for this year was seeing more partnerships between startups and incumbents. And I love it. I love to see it.
Well, it's going to be interesting. You guys probably saw the FDA confirm that the shortage on Eli Lilly's obesity drug has been resolved, which means it's going to put the compounding industry or sector on notice here. So it's going to be really, really interesting. So it's a really strategic move on Eli Lilly's part, because if it's harder now to compound with the FDA confirmation this morning, those partnerships could be very, very lucrative.
Yeah, they want to create those access
Great.
channels.
They can bring the price down then. I mean, a lot of people are going off brand because it's a lot cheaper. So bring down these costs. And the other thing that's cool about a Roe Zepbound partnership is there's no middleman like taking, there's no, I imagine there's no PBM involved because it's cash pay. It's going direct, they're the pharmacy essentially. They're the prescriber and they have the pharmacy. So hopefully they can offer lower costs. Hopefully.
And I think since we're talking about the weight care space, I think another space we've been watching really closely is food as medicine, right? I think it's moved from kind of this more niche wellness fad into, this increasingly like clinically validated and integrated support for chronic care management. It's used in the context of value-based primary care. And we have seen a lot of movement when it comes to reimbursement of CPT codes for dietitian visits, for just Medicare Advantage plans, offering medically tailored meals, access to healthy groceries. It's interesting, though, because when I chat with folks, though, it still seems like kind of the spottiness of reimbursement is coming in the way of this having a scaled impact. Also just wanting more kind of clinical and economic research to validate outcomes. But I think like with the new administration, it'll be really interesting to see this space because I think you've heard from them that very invested in how do we highlight nutritious food? How do we promote nutritious food? But at the same time, you could also see them making changes around the Medicaid 1115 waivers, which give access to a lot of this food and medically tailored meals. You could see kind of impact on the SNAP program, which does the same. So a little bit of a push-pull there, and we'll have to see how it plays out. But I think like when you think about the role that kind of weight care programs are playing right now, the buyers of those programs, so the employers, the health plans, they are so interested in how do you make these programs have sustained outcomes? And you could see food as medicine playing a role in that. So might food as medicine be kind of a first course of treatment before someone goes on GLP-1s? Is it something alongside GLP-1s? If somebody is trying to taper off of their treatment, is it a way to kind of reinforce these healthy nutrition behaviors? So I think regardless of some of the kind of government reimbursement pieces of food as medicine, I think it will get this uplift from some of the movements and expectations that we're seeing in the weight care space and what we want to happen there.
Yeah, that's super exciting.
So how did women's health fare this year?
Yeah, so we saw reproductive and maternal health was 5th on our list. So we will look at funding according to the amount that goes into different clinical areas. And so, as I mentioned, mental health was number 1, oncology was up there, cardiovascular care, weight care, and then kind of women's health came in. We try to be a bit more specific than that. So in this case, it's kind of reproductive and maternal health. That's a good deal higher than it was last year. It was actually in 12th place among all of our clinical indications last year. And I think it definitely got a lift from large raises, for example, from
menopause.
MIDI as well had a big raise earlier this year. And I think it's really exciting, especially with MIDI. I think just the traction that they've gotten in the strategy with connecting into health systems has been so powerful. They're so purpose-built to take care of women who are experiencing perimenopausal and menopausal symptoms. And what I've heard is that a lot of the patients that come through their kind of virtual doors haven't necessarily had all of the cancer screenings that they need. They haven't necessarily even had a primary care physician. And so even though the woman is going there to treat their menopausal symptoms, the connections with the health systems make such an easy glide path into any additional screenings or care pathways that person might need. And so I think that partnership is super, super powerful in terms of how we're seeing these kind of emerging front doors and access points, just like really purpose-built virtual care for particular populations. It's what consumers want, but having that kind of connection and integration when higher order care is needed is just so, so important.
Well, we always say this in the fertility and pregnancy space. This is often a woman's first real interaction with the healthcare system, right? Like she's had maybe very casual 15-minute wellness visits every year, but that's generally tends to be the big health moment of their on average, 28 is the average age of pregnancy in the US. And then you have children, and your entire world is taking care of those children, and your health comes second, third, fourth.
And going to the pediatrician.
Yeah, it's all, your whole healthcare experience is around a child. And then menopause, however, 20 years later, is like your next big introduction. So I love that you said kind of this front door, because I wish we didn't have to wait for these life moments to engage, but we at least have great companies like MIDI that are around to say, all right, you're having this big life change, you're going into a new life phase, like let's take care of you holistically.
Mm-hmm. Absolutely.
Yeah, I'm really hopeful, Hallie. I love the way you frame that. I'm really hopeful that this becomes a breakout moment for primary care. I mean, at the end of the day, I think, let's be honest, unfortunately, I was the typical patient. I do my yearly checkup every 3 to 5 years, and there was just no ownership.
Wait, you only go every
advocacy.
3 to 5 years?
I used to until I turned into my early 40s.
Dr. Kamate then changed you.
That's it. And I think the relationship and the trust that some of these platforms like MIDI, which is a terrific company, are establishing those trusts with these patients, and now they become effectively their de facto primary care provider. And so I hope this is a wake-up call and a breakout moment for that sector.
I mean, just on that note, Michael, since we have an honorary male in the room, I did some research around, like, do we need an OBGYN for men? Because urology really isn't it, right? Like our OBs, totally. We see them, ideally every year. They're the person we go to with any women's health issues. And men who have lower life expectancy than women, urologists aren't the one. There's really no one other than in primary care, which we obviously have a shortage of. But maybe there's a new specialty. Maybe there's a men's specialty that can be the men's door to health. And I think the only thing I'll say is I think it's interesting that Hims and Roe both started as men's health companies.
Yeah. And it's not just men's health. It's like also all the cultural competency that's being embedded into these models. It's like we all want to be seen and heard in our kind of identity, like in what we care about, integrated into our healthcare. So I think it makes a ton of sense. That's super interesting, Hallie.
Megan, did you cover the IPO market at all for the report?
So not in a huge way. We kind of looked at, of the couple of companies that kind of went public this year are still public. Like how are they faring? I think they're largely up. It was I want to say Waystar as well as Tempus. We just checked the numbers like the other day. So Waystar was up a good amount, like 65%. Tempus was up just about 6%. The markets will have shifted by the time this comes out. We, like you, were kind of looking at some of those companies that delisted. And sometimes that can be a healthy change. Oh, yeah. Taking it private, figuring out, like, are there other assets that they want to acquire? How do they want to refocus? But it's been kind of interesting to see more of that movement, I would say, in the first half of the year. And then with Hinge and Omada potentially laying plans for next year. Again, I think it'll be a really interesting barometer of how the market is responding to, like, what are truly tech-enabled services, like healthcare delivery companies.
Yeah, I agree. I think it's good to have a little bit of a cleanup of the index, because otherwise there are weaker companies that perhaps leave a distaste for public market investors. And so just having, letting the stronger companies continue to lead the way and get investors excited about digital health makes a lot of sense.
So Megan, as you're sort of thinking about the IPO market in 2025, is the Rock Health advisory team bullish, cautious, negative?
I think that I'll kind of piggyback off of what Hallie said, that I think that kind of like the private market adjustments that I was talking about in terms of having this SaaS mentality to now, like, truly evaluating what the margins and value of these companies should be and the growth trajectories. Also adding to that, which I didn't mention before, is, you see pivots like what Brightline did earlier this year in terms of not just wanting to offer mental health care for kids and families virtually, but starting to really build hubs with brick and mortar facilities. And so I just think that, like, digital health is so diverse, right? It's really not one type of company. And so I think the markets are realizing that, right? Like, health tech isn't just a healthcare SaaS company to be valued a certain way. you really have to look at what the model is, what the growth trajectory is, what the capital is being used for, what the margins are. And so I think it's hard to say, like, on the whole, we expect this to happen for all the companies, but I think that the market is getting a lot savvier at valuing these companies, which is exciting to see, and that will have trickle-down effects into the private markets too.
I hadn't thought about it that way, but the public investor base getting more savvy about the disparate models here. We at Fenwick certainly are very optimistic in terms of the window for next year. I mean, now I'm speaking broadly beyond just digital health and health tech and tech-enabled services. But, it's going to be a very, very interesting year, and we'll see what the first quarter brings. And does that start to really continue the thawing that we saw with ServiceTitan and some of the other recent offerings? So we're cautiously optimistic, that next year is going to be a robust opportunity for some terrific companies that have really, to the comments earlier, have really right-sized their business models, have really got themselves dialed in. And I think there's really some promising upside here for public company investors in 25.
And I think just to call back, like, the kind of the David Goliath theme that we're using to frame some of what we saw this year, in addition to the capital concentration that we're seeing amongst a few VC funds, we're also seeing that concentration when it comes to something like AI. So think about the amount of just technical horsepower, the amount of money that it takes to build these foundational models, right? Like GPT, like, it just makes sense that Microsoft, Google are going to keep being the key players when it comes to serving healthcare enterprise with their AI needs. I also think that continue to talk to health systems. Epic and Cerner are still kind of the big players. They're really upping their game when it comes to AI integrations, and that's going to crowd out kind of some innovation bets that they might be making otherwise. But when I think about, there is this kind of concentration of capital, there's this kind of concentration of players like in the big tech space that are going to have an outsized influence on the future of AI. I also think about, like, interest rates are lowering. I think about the ways in which early stage players and smaller players have always found the niches, the needs of particular populations, the places where the big players aren't playing. So obviously, as Rock Health Capital continues to invest in these early stage companies because we think that there's a really, really critical role to play, even for these small players that are going to be building kind of layers and integrating into these foundational AI models, but finding specific fine-tuned use cases for healthcare. So I think it's always the balance, right? And that's what we're excited to continue working with our clients on, is when you think about where innovation comes from internally with these big enterprises, from these small companies, from big tech and these big vendors, you're always making trade-offs around, okay, do we build, do we buy, do we partner? Like, where is what we need coming from? And I think this past year, we saw a lot of what they need is going to be like influenced or come from these big players. But I think in the coming year, like, we're really excited about those early stage companies that are continuing to get funded with all of the strong fundamentals that we've been talking about.
Just to wrap it up for our listeners for our last question, in 2024, I'm actually going to ask this to both of you, put you both on the spot here.
Oh boy.
What is one word you would use to describe 2024?
Wow, you're asking a lawyer to limit himself to one word? Megan, I'll let you go first.
So I'll give an answer, but I feel like it kind of flies in the face of the conversation we've been having. So you can decide if you want to keep it in or cut it. But I would say, like, where we are landing this year, and in terms of like where we are starting, like, I would actually say turbulent. Like, I think that there's a good amount of uncertainty coming with the new administration. I do want to acknowledge that we're in a moment, like, with the real loss of life of Brian Thompson. Like, I think people are asking really hard and really fair questions of a system that hasn't necessarily served them well. And I think that people may be starting to equate the ills of the healthcare system with the people working in that system. And I hope that we don't lose assuming good intentions, because I think most people are doing their very, very best. to make this system a lot better and actually have a lot of the ideas for how we will make it better. So I hold a lot of optimism. But I think in this moment, I am feeling more turbulence.
I think that's a great answer and
maybe I
explanation.
expected.
Yeah.
Well, Hal, you're not going to get off the hook on this one either. But I'm going to take the optimistic angle that Megan alluded to, and I'm going to say 2024 was about resiliency.
And we saw I like that.
A lot of companies, weather those turbulent internal storms. We saw them right-size their business models. We saw this really growth with a profitability driver, and this 2024, despite the roller coaster ups and downs, was a year of resiliency for our industry.
I don't know.
Resilience among turbulence. I like that.
Amongst the turbulence.
Yeah.
All right, Hallie.
I want to say something like boiling point. Like we kind of reached, I
kind of like that, actually.
We reached this boiling point for a lot of aspects of our healthcare system. We have been raising the flags about all these issues for so long, all of us that are working within healthcare. And finally, we have people that are outside of healthcare that are oh, this is a messed up industry. And we're we've been telling you that. You know what I mean? We had the FTC report on the PBMs, right? We have been complaining about the vertical integration and health plans gobbling up all these companies to the dismay of patients. We've been complaining about this for years. And, now we have an FTC report on it. And hopefully that's changing.
I really like that too, because I think it applies to the boiling point of at the beginning of the year, we were how are all these big companies going to deal with their valuation hangovers? Are they going to be able to raise their next labeled round? Are they going to get to exits? And I really liked the point that you brought up about the unicorns, where these companies are resilient, they are working through. And so you got to this boiling point, and then it's what happens next? And we're seeing a lot of resilience with what happens next, which is exciting.
Yeah, perfect. So turbulence, boiling point, resiliency, and there you have 2024 in a nutshell. I don't know about you guys, but I'm exhausted. This year was intense. I mean, I didn't think we could beat last year with the SVB shutdown and everything that happened in 2023, and then 2024 was even crazier.
Really. This has been super fun. Thanks so much for having me.
Yeah, Megan, thanks for being here. Wishing you a very happy new year.
You too.
Happy holidays, Megan, and all our listeners.
Sorry, just because Michael and I are the biggest of Dodger fans, just got to throw that in there.
Yes!
This was also a big year for Los Angeles.
What a great year for us.
Yes.
Way to go, Megan.
A big bright spot. There you go.
In an otherwise turbulent time, there was a moment of joy, of resiliency in our LA sportshood.
You're so funny.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Hallie Tecco and hosted by Michael Esquivel, Steve Krause, and Hallie Tecco. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and details.